There's a question that comes up more often than you'd think, quietly, almost apologetically, but it matters deeply to so many couples trying to navigate intimacy with confidence and care. Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon, and if you've ever faced questions or concerns about your urological health or about intimacy and connection with your partner, stay with us. We're here to help you understand your body with clarity and comfort. Today, we're talking about something personal, something many people wonder about but rarely discuss openly. Oral intimacy, specifically regarding vaginal fluids. Is it safe? What's normal? What should you know? I want you to feel at ease. This isn't shameful, it's human. And understanding the biology, the safety, and the emotional dimensions of this topic can actually bring you closer to your partner, not further apart. So let's talk about it, honestly, medically, and with the warmth this conversation deserves. Why this question matters. In my clinic, I hear variations of this question almost daily. Doctor, is it safe to swallow vaginal fluids during oral intimacy? What if the taste or smell seems off? Does that mean something's wrong? Could this cause health problems? The people asking aren't being inappropriate. They're being thoughtful. They care about their partner's health and their own. And they're trying to make informed decisions in an area where clear, compassionate guidance is hard to find. What's changed in recent years is that intimacy is no longer a topic reserved for the young. I see couples in their 50s, 60s, even 70s, exploring new dimensions of closeness. Some tell me they're experiencing oral intimacy for the first time in decades, or ever, and they describe it as a revelation, a reconnection. But with exploration comes questions. And when those questions go unanswered, anxiety fills the void. Uncertainty creeps in. And what could have been a beautiful expression of trust becomes a source of stress instead. That's why we're here today, to replace fear with facts and shame with understanding. What are vaginal fluids? Really? Let's start with the basics. Vaginal fluids aren't just moisture. They're a carefully orchestrated part of your body's design, a sign of health, readiness, and protection. These fluids serve multiple purposes: lubrication to reduce friction and discomfort, protection against infection by maintaining a healthy pH, communication from your body that arousal and intimacy are welcome. Even after menopause, these fluids continue to play a vital role in comfort and connection during intimacy. Now, where do they come from? There are three main sources. 1. Bartholin's glands, located on either side of the vaginal opening. These tiny glands release a slippery fluid during early arousal to ease friction. 2. Skene's glands, positioned near the urethra, sometimes called the female prostate. These glands produce additional fluid during deeper arousal and may contribute to female ejaculation in some women. 3. The cervix. This produces mucus that changes throughout the menstrual cycle, helping maintain vaginal balance and moisture. Together, these create a clear or slightly cloudy fluid that's a natural, healthy part of sexual response. This isn't dirty, it's not dangerous, it's your body preparing for connection. What about taste and smell? Just like sweat or saliva, vaginal fluid varies from person to person, and even day to day. Hormones, hydration, diet, stress, medications, all of these influence taste and smell. For example, a woman who drinks plenty of water and eats fruits and vegetables may have a lighter, subtly sweet taste. Pineapple and citrus fruits are often said to make the taste more pleasant. Garlic, onions, coffee, and alcohol can make the scent or taste stronger. Hormones matter too. Around ovulation, fluids are more abundant and closer to neutral. Before or after menstruation, a trace of blood may give a slightly metallic taste. After menopause, lower estrogen can reduce fluid volume and slightly raise acidity. Here's what I want you to hear clearly. All of this is normal. A woman's natural scent and taste are part of her individuality. Just as everyone's sweat smells different, so do vaginal fluids. This isn't a flaw, it's biology. When should you pay attention? That said, sudden changes can be your body's way of sending a signal. Common harmless causes include tight clothing trapping sweat, Residual urine near the vaginal opening, mild imbalances in vaginal bacteria, more noticeable changes, especially with itching, discomfort, unusual discharge, or a strong unpleasant odor, might indicate bacterial vaginosis, very common, easily treated. Yeast infection, also common, also treatable. Other infections that require medical attention. None of these are shameful. They're medical conditions like a cold or a skin rash. They happen, and they respond well to treatment. The problem isn't the condition, it's the silence around it. When couples don't talk about these changes, anxiety grows, intimacy shrinks, and distance replaces connection. Is it safe to swallow vaginal fluids? Now let's address the question directly. In a healthy, mutually monogamous relationship where both partners are free of sexually transmitted infections, STIs, swallowing vaginal fluids is generally safe. Here's why. Vaginal fluid is mostly water, with a mix of amino acids, enzymes, minerals, glucose, and beneficial bacteria like lactobacilli. These components help keep the vagina healthy and protected. From a medical standpoint, the risk of exposure is lower than many everyday activities, like sharing a drink, deep kissing, or eating unwashed fruit. But, and this is important, safety depends on health status. The role of STIs, vaginal fluids like semen or blood, can transmit sexually transmitted infections. Infections such as chlamydia, gonorrhea, herpes, syphilis, trichomoniasis, HIV can all be passed through genital fluids, including during oral sex. The risk is higher if one partner has an active infection, the receiving partner has cuts, sores, bleeding gums, or ulcers in the mouth. This doesn't mean you should avoid intimacy. It means you should approach it with both love and wisdom. Wisdom here looks like knowing your own health status, talking openly about sexual health with your partner, getting tested regularly, just like checking blood pressure or cholesterol. A story from the clinic. Let me share an example. A man in his 60s called me after being intimate with a new partner. He'd brushed his teeth too vigorously beforehand and noticed his gums were bleeding. Now he was worried. Had he exposed himself to HIV? His fear was real. But here's the truth. The risk of HIV transmission through oral sex is very low, though not zero. I encourage both partners to get tested together. The results came back negative, but something beautiful happened in that process. Getting tested together didn't create distance. It created trust. They felt safer, more honest, more connected. That's the deeper truth here. Safety doesn't destroy romance. It strengthens it. When both partners know they're healthy, intimacy becomes freer, more fearless, and far more joyful. Practical steps for safety. Here's what I recommend. 1. Talk about testing. Ask gently, or better yet, suggest getting tested together. This isn't distrust, it's partnership. 2. Use barriers. If needed, dental dams or other barriers can be used during oral intimacy, especially early in a new relationship. This isn't unromantic, it's respectful and responsible. 3. Make testing a routine. Even long-term couples should consider testing once or twice a year. Health changes. Transparency keeps you both safe. If both partners are healthy. If you and your partner are both infection-free, swallowing vaginal fluids is safe. More than that, it can be an act of deep acceptance. Many women feel more loved, more desired, more fully received when a partner embraces them completely without hesitation. It's a message that says, I trust you, I celebrate you, I accept all of you. What if the taste or smell changes? Let's talk about something most people are too embarrassed to ask. First, let me reassure you, changes in taste or smell are completely normal. Vaginal fluid can be musky, salty, tangy, or subtly sweet. It shifts with hydration, diet, hormones, and stress. Pineapple, citrus, and berries may lighten the taste. Garlic, alcohol, and coffee may intensify it. Hormonal shifts, ovulation, menstruation, menopause, naturally alter scent and flavor. Here's what I want every man to hear clearly. A woman's natural scent and taste are not flaws. They are part of her health and individuality. There is no reason for shame. The only time to be concerned is if there's a sudden, strong, unpleasant change accompanied by itching, discomfort, or unusual discharge. In those cases, the cause is usually something simple and treatable. Bacterial vaginosis, very common. Yeast infection, also very common. Both respond well to medication. Neither is shameful. How to respond as a partner. If you notice something different, here's what not to do. Don't pull away, don't criticize, don't joke about it. Those reactions create shame. Instead, approach with kindness. Suggest a refreshing shower together. Encourage hydration. Make it teamwork, not judgment. When couples face changes in the body together, intimacy deepens. It doesn't disappear. The emotional meaning. For many women, especially as they age, acceptance is more powerful than technique. When a man chooses to fully embrace his partner, including her fluids, he's saying, "I accept you completely. I love every part of you." That message heals years of quiet shame many women carry about their bodies. It transforms intimacy into trust, and trust into deeper pleasure. And here's a secret for men. When a woman feels that safe, arousal deepens, orgasms intensify, and her willingness to be fully present with you multiplies. Acceptance arouses, judgment shuts down. So, to summarize, is it safe to swallow vaginal fluids in a healthy relationship? Yes. Are changes in taste and smell normal? Yes. What really matters? Communication, honesty, compassion. Because at any age, intimacy isn't just a mechanical act. It's about how deeply you make your partner feel safe, wanted, and accepted. A final word on men's health. Before we close, let me share something important for the men watching. Too many of you waste money on unproven, unsafe supplements online. That's why I only recommend 2 evidence-based options. I'll leave links in the comments and description. If you want moderate, clean support, try organic watermelon extract, rich in L-citrulline, which improves nitric oxide, promotes blood flow, and supports firmer, more reliable erections. If you want a more comprehensive boost, not just blood flow, but testosterone, stamina, libido, and prostate support, consider an advanced formula. This combines Icarian, horny goat weed, for blood flow, hardness, and stamina, Tonkat Ali for testosterone and libido, fenugreek for desire, energy, and orgasm intensity, nettle root for hormonal balance and prostate health, citrulline for nitric oxide and vascular function. Together, they support every aspect of male function: circulation, hormones, stamina, desire, and prostate health. Choose what fits your goals. Links are at the top of the comments and in the description below. Take care of your health, your confidence, and your intimacy, because passion doesn't retire. I hope today's conversation brought you clarity and comfort. Don't be embarrassed. Ask your questions. Seek understanding. Healthy intimacy is possible at any age, for anyone willing to approach it with honesty, care, and compassion. Take care of yourself and your partner. You're both worth it.